Let's talk about the pathology behind Parkinson's disease. Following Alzheimer's, Parkinson's disease is the most common neurodegenerative disorder.
So, what are the symptoms of Parkinson's disease? Symptoms of Parkinson's disease can include bradykinesia, which is slowness of movement, muscle rigidity, postural instability, tremors while at rest, and cognitive impairment.
Most of us take for granted our own muscle control and coordination. I can easily wave or snap my fingers just by thinking about it. But our motion requires our highly complex nervous system to be functioning. Damage to the regions of our brain that are responsible for motor function can make voluntary muscle control difficult, which is what happens with Parkinson's disease. Here's how it works.
Our nervous system is composed of cells known as neurons. Neurons are grouped together in a complex network of pathways. Think of neural pathways like a system of roads. If neural pathways are roads, then the junctures between neurons, known as synapses, are like traffic intersections. Signals run through the intersections like cars. If an excitatory signal is released, information and motor controls have the green light to jump to the next neuron. However, if an inhibitory signal is released, it will break the chain of communication, acting as a signal stop sign that will prevent communication from continuing. Three regions of the brain are primarily in charge of motor function: the motor cortex, the basal ganglia, and the thalamus. Our motor cortex signals an intention to move to the basal ganglia. There are then two pathways that can be taken in the basal ganglia. A direct pathway of neurons in the basal ganglia switches off inhibitory neurons connected to the thalamus, which allows the body to then move. However, if the indirect pathway is taken, the inhibitory neurons are activated, which then causes motion to either stop or motion is prevented. People with Parkinson's disease have a difficulty using their direct and indirect pathways.
Dopaminergic neurons run the direct and indirect pathways in the basal ganglia, and people with Parkinson's disease lack dopamine, the neurotransmitter or signal molecule that these dopaminergic neurons rely on. There are drugs, such as levodopa, that are able to increase the dopamine levels in the brain. However, prolonged use of drugs such as levodopa can lead to some nasty side effects. There are also some technological solutions, like the neurotechnology of deep brain stimulation. However, these technologies are simply aimed at alleviating the symptoms of Parkinson's disease. They're not actually a cure. So it's important that we continue learning about Parkinson's disease in order to design effective treatments that will help people in the future who are suffering from this neurological disease.